Hello, everyone, and welcome to this month's Heart Bunch video, proudly brought to you by the Health Extension Advocacy Research and Teaching Initiative, also known as HEART Initiative. This month, we're going to be talking to you about supporting loved ones with mental health concerns, and I'm just going to jump right on in and get us started. We wanted to give you 5 ways to offer support to your loved one who might be having either mental health concerns, substance use disorder concerns, or other concerns. And you as a family can recognize your power as the first thing to do, because families are often one of the first people to notice changes in behavior, changes in patterns that people are having, and can be a really big support network for people who are struggling and people who might need some support at the time. Family can also really help destigmatize things and help people get the treatment that they need. And sometimes there can be even whole family therapy that's really effective for people, and getting family members involved and learning how you can be really helpful for your particular loved one. So I wanted to just recognize your power today to get us started and know that you do have things that you can do as a family member. And I'm going to pass it over to Gabby to talk about what else we can do.
Thanks, Ashley. Next up, we want to avoid stigmatizing language and beliefs. So, we've probably faced or have experienced stigmatizing language, or maybe we've used it and we just didn't realize it. But understanding, that stigma is kind of like labeling differences as negative. It kind of creates that rift between us and them. And then for those who experience stigmatization, it can lead to, feelings of isolation, maybe discrimination, and it can kind of affect how likely someone is to reach out for help and assistance. And especially with things like mental health concerns, they're looking for that support a lot of times, but if they feel stigmatized, it can lead them to kind of stay away from that, feeling like, they don't want to reach out and get the help that they might be looking for. So what about the next tip? Rachel?
The next tip is being available, specifically reaching out, listening, and being patient. Social support helps people to cope with stress, and feeling closeness to others has benefits also even just to our general health. So it can benefit our heart, immune system, and overall health. You can show your loved ones that you're available in a variety of ways. Maybe it's through a video chat. You can always call them on the phone, send them a text, or any way that you can connect with them that feels meaningful and right to both of you. So when you are connecting and reaching out, one thing that's helpful is asking open-ended questions so that it gives your loved one time to answer you in a meaningful way. And something else that you can speak with specifically about is your family's history of mental health concerns. Being open about genetic predispositions that might be affecting your loved ones can help them understand themselves and also feel less alone and connected to others. And then the final portion of this tip is just to be patient. It can take time for your loved ones to locate resources that they need to help them feel better. So allowing that time can be really helpful. All right, over to Maren for the next tip.
So I'm going to talk about being hopeful. And, a lot of times we think of hope as like this ethereal thing, like fairy dust, maybe. Something like, I sure hope I win the lottery, or hopefully you're going to get that ideal parking spot, right? So hope, sometimes we think of it as a silly thing, but hope is so much more than that. So it's more of an assurance that comes out of lived experience. So really, it's the foundation for resilience, because it's acknowledging the struggle of the past and still sort of tying it to some anticipated future, some expected outcome that we really can have hope and assurance in. So in order to offer hope, you want to be real. You want to speak from your experience. And you want to reassure your loved one that, that this is a challenge we can get through together. We've been through hard things in the past, and that means we can get through this going forward. And so be hopeful, be real about it, be genuine, and know that, that you can get through this together, and offer that as a way to support a loved one who's struggling. And on to our last one, taking care of yourself.
Thank you, Marion. When a family member enters any form of mental health treatment, including substance use disorder treatment, the hurt and confusion the family feels obviously does not go away. So one of the things we want to advise you to do is to educate yourself, ask questions about the treatment your loved one's receiving, communicate as well as possible with everyone involved. It's important for family members to seek support for themselves and consider family therapy with their loved ones to rebalance family dynamics and allow for healing. For example, in marriage and family therapy, the unit of treatment isn't just a person, it's a set of relationships in which a person is embedded. So educating yourself on those areas would be very helpful going forward. Finally, being a family member and caregiver is difficult and stressful. Make sure you're taking care of your own needs. And some of those needs we're going to talk about, understanding how stress affects you, and learn some skills to take action to reduce those. Some of those tips will include eat well, exercise, find a relaxing stress reliever, speak with supportive family or friends, sleep, avoid alcohol and other drugs, and drink plenty of fluids, hopefully water. We talk about that in general, but I think it's really helpful when someone is under a significant amount of stress and concern for their loved ones. And finally, practice personal positive mental health habits. Avoid guilt, try not to judge yourself too harshly. Notice the positive, what's better today in your family, the family caregiver, with yourself, with the person going under the treatment, and find support. We know it's difficult. Support groups are available in a variety of organizations, including public and private. Online, for example, NAMI, SAMHSA, those are just the two that we have. We have some resources here. We want to thank you for following the HEART team. And these resources are available for your review. We wish you the best.